Gentlemen, are you over 50 years old, or have you been having urinary problems for some time now? Several diseases can affect your prostate, and it's important to detect them early. Let's take a closer look. The size of a walnut, the prostate is located just below the bladder in front of the rectum. It looks a little like a heart, and its two main lobes surround the urethra, the tube that connects the bladder to the penis and carries urine and semen. The prostate is a reproductive gland essential to fertility. Its main role is to secrete the fluid that protects and nourishes sperm cells. So basically, no prostate, no ejaculation. Your prostate secretes a protein known as prostate-specific antigen, or PSA, which keeps semen in liquid form after ejaculation. Found in small quantities in the blood, this protein lets you know how healthy your prostate is. From the age of 50, it's important to start paying attention to certain symptoms. The prostate increases in size and can compress the urethra. If this happens, you may feel the need to urinate more often, especially at night. You may also have trouble urinating, ejaculating, or completely emptying your bladder. If such symptoms persist, you should seek the help of your doctor. It could be benign prostatic hyperplasia, or BPH. Other diseases, such as prostatitis, can affect men of all ages. Prostatitis is a painful inflammation of the prostate and can cause urinary or sexual disorders. It can also lead to an infection, fever, and chills. Your doctor will determine how to treat it depending on whether or not its cause is bacterial. Another major disease that can affect the prostate is cancer. This can occur when prostate cells multiply uncontrollably, forming a malignant tumor. Prostate cancer is the most common form of cancer in men, and it can be quite sneaky as symptoms are few and even non-existent at first. However, if it is discovered early enough and is limited to the prostate cancer is curable. That's why screening is so important. Among those at the highest risk of developing prostate cancer are men aged 50 and over, black men, and men with a family history of prostate cancer or another form of cancer. If you think you might be at risk, talk to your doctor. Screening can detect prostate cancer at an early stage, before symptoms appear and before the disease spreads. But let's get back to the PSA, the protein secreted by the prostate. A simple test can measure the PSA level in your blood. If this test shows a higher than normal PSA level, it doesn't necessarily mean you have cancer, but it does require further investigation. It could indicate an enlargement or inflammation of the prostate or even a urinary tract infection. Ideally, your PSA test should be paired with a digital rectal exam that checks the size and texture of your prostate. While there is no proven strategy for preventing prostate cancer, making sure you maintain a healthy lifestyle can help reduce your risk. Exercise for 20 to 30 minutes a day, maintain a weight that is appropriate for your age and height, and think about choosing fruits, vegetables, fiber, and protein over animal fats and processed foods. Questions or concerns? We're here for you. ProCure would like to thank the specialists, nurses, and patients for their help in the realization of this video.